Okay, so first of all, let's talk about the impacts of exposure. So we've kind of known about the problems or the dangers associated with eating moldy food for a long time. So there are food standards that limit mycotoxin contamination in grains and many other foods in various countries around the world for that exact reason, right? We know that that can be problematic. But there is far less recognition of how mold and mycotoxins cause illness when they are inhaled rather than when they are ingested. Okay, so, you think about a water damaged building. And what happens in a water damaged building is this phenomenon called amplification. So that is where certain molds and bacteria and various other microbes that are existing in a water damaged building, they are able to flourish and to produce significantly more biotoxins because of that environment that's created inside a water damaged building. Okay, so it's kind of the perfect storm for these these molds and bacterias to be able to produce more biotoxins. So when these toxins, these biotoxins, are inhaled over time, so it could be weeks, weeks, months, years. So people that are doing that in either in their living environment or even their working environment, anywhere that you're spending a significant amount of time, anyone can become unwell in those situations. So some of the subsequent health issues that can arise are, one is allergy. Okay, so often it will manifest as respiratory type symptoms, so maybe cough, sinus, maybe a little bit of breathing difficulty or headache, something like that. There can be fungal infection. So things like, tinea, athlete's foot, thrush, things like that. There can be actual toxicity. So, really significant levels of any toxin can cause an actual toxicity in the body. And then lastly, and most importantly, at least for this video, is an overactive innate immune system. And this is called CIRS, or chronic inflammatory response syndrome. So in this latter case, the immune system can detect the biotoxins in the system, but it is unable to remove those biotoxins from the body. And that's, likely because of a particular set of genes that one might have. And so what happens, when the body can detect something but not remove it, you can imagine that there is just this inflammation that happens. There's a low-level chronic immune response that causes the body to become more and more inflamed over time, and that causes this chronic inflammatory response that CIRS is named for. Okay, so what can you do about it if this is something that is affecting you? So the first thing to do is to determine and eliminate the source of the mold exposure. So this might involve addressing mold growth in your living environment or your working environment, sometimes even your car, really anywhere that you spend time. So professional mold remediation is usually necessary if there's a significant, exposure, a significant problem. And if that's the case, make sure you find somebody that knows about CIRS and that is IICRC certified. You can find many people online on the Toxic Mold website that tells you about remediators. You can also go to the Building Biologist of Australia website to get some information there. And just to give you a general idea, there is something called the ABCs of mold remediation. So the A is abate the water intrusion. B is building materials that are contaminated must be removed. So don't try and kill the mold. You need to remove any affected building materials. And then C is clean reservoirs on possessions, on all surfaces, and in the air. Okay, so all possessions must be cleaned, all surfaces must be cleaned, and the air must be cleaned. Typically, porous materials cannot be cleaned, but non-porous can. Okay, so that's just to give you a broad idea. Next, if since CIRS is a multi-system, multi-symptom illness, you can complete Dr. Shoemaker's symptom cluster analysis to determine if you might have CIRS or what the likelihood is that you might have CIRS. So you can find this actually for free on my clinic website at drkatehealth.com. So, those survey results will come to me and I will respond and tell you what the likelihood is that you have CIRS. So please feel free to use that resource. The other thing you can do is to complete a visual contrast sensitivity test or a VCS test. You can find that online at vcstest.com. And that will tell you if you have, significant neuroinflammation that is suggestive of CIRS or biotoxin illness. So if both of those are positive and you start to really suspect mycotoxin exposure, then it's really crucial to consult with a healthcare professional that has expertise in that area. So, they can assess your situation, they can conduct the relevant tests, and they can provide you with personalized advice. Okay, so in terms of general treatment, now obviously everybody is different and you really should go and speak to a clinician like I just suggested. But just to give you a broad idea of what we would do in the clinic, I kind of work through a particular framework, but I also tailor things to each individual. So just to give you an idea of the broad framework, first of all, we always work on diet and lifestyle. So we would specifically remove foods that are high risk for mold growth. We would try and reduce systemic inflammation that is being caused by mold with an anti-inflammatory diet and also lifestyle protocol. We would be introducing lots of foods that are rich in antioxidants because that helps to protect cells from oxidative stress and oxidative damage. So things like berries, leafy greens, colorful fruits and veg, all of that kind of stuff is great. Next, we would typically move to supporting the gut. So this may include things like leaky gut support, microbiome support, possibly antimicrobial or antifungal therapy if it's necessary, stomach acid support, motility support, really anything to normalize that gut function. So we want to make sure you're pooping at least once a day, if not twice or 3 times, because it's really important when you're trying to detoxify from mold, since the stool is a major carrier of toxins, right? So you want to make sure that's consistently being moved out of the body and not lingering. Next, we would typically support the nervous system and possibly introduce some kind of brain retraining technique. So the reasoning behind that is that when you inhale mold spores, the tiny airborne particles travel from your nasal passage through your nasal epithelium and straight into your brain. So, as those mold spores and the mycotoxins cross into your brain, they stimulate activity in the amygdala and the hippocampus, and they are part of the limbic system. And so, either an acute exposure where there's a high dose of mold or mycotoxins, or a recurrent low-level intermittent exposure, either of those two things can alter the limbic system response and essentially kind of hijack that system. And that hijacking really stimulates the activity primarily concentrated in your limbic system, which then bypasses the more rational prefrontal cortex of the brain. And that really triggers an onslaught of kind of neural and psychological abnormalities. And this can really be thought of as a type of chemical trauma. And what we see is that people often get stuck in this fight or flight type of mode, very anxious, have lots of ruminating thoughts, possibly, lots of overactivity, maybe overvigilance when it comes to mold, always being concerned. So it's really crucial to reset that limbic system by rewiring it to a more kind of balanced, restful state. And then finally, Once we've done all of that, we support detoxification. So I do that typically in three main ways. The first one is we support the detox organs by using all of the suggestions that I mentioned in video 2, okay, on day 2. Second, we support bile flow with various kind of bitter herbal cholagogues that are typically bitter herbs. So things like dandelion root, burdock root, orange peel, things like that. And that is really because we want to get that bile moving, because the toxins will, kind of accumulate in that bile, and we need to get that bile moving in order to remove those toxins. And then finally, still sticking with the bile because it's so important, is we need to stop the recirculation of the toxin-laden bile. And we do that with binders. So things like charcoal, ochre, bentonite clay, there's lots of different natural binders. You can also go with prescription binders like cholestyramine or Welcol. All of those, kind of attach or bind to the toxins in the bile and allow them to be moved out through the stool in the GI. Now, I really do suggest that you do this under the guidance of a practitioner that knows what they're doing. Often people with mold illness can be pretty sensitive, and, you really need guidance when you're starting these protocols. Okay, so that's it for now. Thank you so much. Bye.